Hello, and welcome to CommonHealth, a podcast brought to you by the Virginia Community Healthcare Association, or VCHA. And listeners, as you know, on CommonHealth, we discuss all things community health in the Commonwealth of Virginia. We are amplifying the voices of those who are being served or who serve in community health centers and beyond. And today, we have a fantastic guest. And I know, listeners, I say this all the time, but I can't help it. We just are blessed. And this time around, we've got a fantastic guest, and I'm very excited that we are able to bring her to you all so we can talk about really something that I'm very passionate about and care. When it comes to our providers, not just in community health centers, but our providers here in private practices and academic medical centers, not just here in the state of Virginia, but really throughout the country. But this particular person that we've got today, our guest, Melina Davis, who is the CEO and Executive Vice President of the Medical Society of Virginia. And by the way, there are medical societies in each of your states. And so when I had the pleasure of meeting Melina, and I think, Melina, we've known each other now almost 2 years.
Yes.
Almost 2 years. And so she and I will meet occasionally, do some lunch, kind of chat on different kind of things that are impacting our providers or what we could do to maybe help lift them up in some form or fashion. But she taught me something about a little over a year ago, and I really feel it's important to bring what occurred here in the Commonwealth and some of the work that Melina and her team did at the Medical Society of Virginia to really help advocate for our providers. And then this wonderful program that the Medical Society of Virginia launched. And we have actually extended it into the community health center industry here in the state of Virginia, listeners. So with that, let me just tell you a little bit about Melina, and then we're going to start to ask some questions for you all listeners. So Melina holds an MBA from Virginia Commonwealth University, VCU. She's known for her entrepreneurial approach and ability to motivate and stimulate creativity and deliver impactful results. And let me tell you, listeners, she really does. Melina brings executive level skills in management, technology, marketing, engaged in strategic partnerships. Over the course of her career, she has worked for various nonprofit organizations. She's raised over close to $140 million for some of these organizations. She has also served as a senior consultant with Fortune 500s, as well as at international and regional mid-size firms. Melina, welcome, and thank you. Thank you for being here.
Thrilled to be here with you, anywhere with you.
Thank you, Melina. So with that, okay, I really want to go right into one of the very first things that you taught me, and I really would like for you to teach our listeners as well. And I want you to go back, take a few years back, okay, about a law that existed, right, for our providers. And then what did Medical Society of Virginia, under your leadership, what did you all do to advocate? And then we're going to go and talk about this fantastic SafeHaven program.
Oh, thank you. Like many medical societies and people in the profession of healthcare, we were learning about the onset and growth of burnout and workplace fatigue, career fatigue, right about 2017, 2018. And we were trying to figure out how we help, how we make a difference. And we started with education, like most medical societies or associations. One, educating ourselves, but also then sharing about wellness and burnout. We were trying to find creative ways to address it, and what was the difference we could specifically make where we sat in the sort of environment of healthcare, and how could we add? we started talking to hundreds of physicians and PAs, trying to listen to what they really needed. And they would tell us their stories. We had an event one day, it was a weekend event where we brought just all of these incredible speakers. It sort of felt like a TEDx event. And the second day was filled with coaches and psychiatrists. And most of the folks would always talk to us. But in this room, especially after learning about all these ways you could address burnout and fatigue in your life, the goal was to sort of map your path forward. And we realized in that room, even with all the rich resources we had brought to the table, that what people were willing to share and wanted to talk about was such deeply held fear and pain around what they were experiencing in the workplace, that we realized we had to do more. We had to go farther. We needed professionals with us in the space, but we wondered, why would they talk with us but wouldn't talk in general to professionals about their mental well-being and how to solve these issues? And what we found after all these conversations was that they were fearful. They were fearful of losing their jobs because their employers couldn't take the risk of having somebody who showed any weakness, was the feeling. They might lose their medical license. That was their fear. Even if they talked to a peer, they didn't understand what their peer was responsible for reporting, or their employer was responsible for reporting to the Board of Medicine, so they could lose their license. If they even admitted they had even an inkling of anxiety or depression or burnout. And then they could also hurt their reputation and their referral network for patients. And if you think about it, these are really basic elements in our sense of well-being and strength. And we realized, well, we have to get past the fear. And we are an advocacy organization, and started setting out to really understand what protections were in place in the Virginia Code, to let them have these kinds of conversations before they reach states of impairment, right, where they might have trouble practicing or continuing to practice. And what we realized is there really weren't any protections. While the rest of us enjoy HIPAA protections, as a profession that has a license, you agree to report any incident that you've ever had in your entire life that might be at all associated with your well-being. Wow, what a shock it was to learn that they really were giving up these protections in order to care for the rest of us, right? And what we know is that if people can talk to one another and get professional help, they can get right back in the game. They can be strong again, and they can actually teach others how to do this in a better, stronger way. And we knew that we had to help people. So in 2019, we worked with the Department of Health Professions, with the Board of Medicine, and with the Virginia trial lawyers to really look at what was the right balance for providing protections for our caregivers, but also protecting patients, right? Where was the line? And I think everybody did just a beautiful job helping us craft this legislation. And we went into the General Assembly session in January 2020, asking for protections that would provide confidentiality at the employer level, treat any conversation with a counselor in our program as a privileged conversation and not be used in legal settings, and provide immunity from reporting to the board for anything before there was a probability that the person was impaired to the point of doing harm to themselves or others. And we needed to clarify language in the laws about that so we could make it very clear where the line of responsibility was for reporting patient safety issues or concerns. And so we went into that and put it in as an emergency resolution right before COVID hit. Governor Ralph Northam, after the legislation passed unanimously through both houses, signed this into law, and it was the first of its kind legislation in the country. And it became law on March 8th of 2020, right as the pandemic exploded. We expected to have a year to get the program up and going because it was very new to us. We didn't have a year then. We had to move right away. We all knew that the incredible stresses just amplified in this period of time. And we were able to get resources by July 1 to providers under what is now known as the Safe Haven legislation. And that now is spreading across the country. And we've expanded it since as well.
It's, and we're going to talk, listeners, around the Safe Haven program and what it is and what it's doing for our providers. But going back to what you were talking about, Melina, and the thing that really struck me, right? I've been working in healthcare for most of my career. I've worked with providers, physicians, nurse practitioners, and we tended to look at our providers differently, right? Superheroes. Exactly. Mm-hmm. But when you and I were talking about this and what you just shared, it reminded me that providers are human, right? There's this humanity, and they too are individuals, like you said, who who struggle at times, right? Can be very anxious, can have some bouts with depression, and it really does have to extend. Right? It really does have to extend, that awareness has to extend to our provider community.
That's right. What's also special about them, right, is what's special about our police and military too. They run into fires, right? They run into crises to save us when we are injured, right? It really are people who show up to serve us in the worst of times, right? What that's interesting, it also opens up in a person an opportunity for moral injury, which is a term of just you're there for service. You're there to give of yourself at a level that society doesn't expect from most of us. And then you're injured because you're so open and you're vulnerable in that space, trying to be vulnerable and open for other people's pain, right? The chance to get injured is actually greater, but yet the stigma in the profession is don't show weakness, don't let it get to you, keep going. And we've seen what that's done in our military, and we've addressed it, right? We understand what PTSD is in that sense, but it is affecting our healthcare workers in this very serious way too.
And when we went into COVID and the life, I call it now really the life of COVID, right? We are still seeing we're still seeing some of, I'm going to call it the backlash, right, from that experience it's still resonating, right?
It is. Well, the whole country, every one of us struggled. It was a very, very difficult wartime-like experience for all of us. And we all had different views about how to deal with it. I think we saw a lot of providers were dealing with patients that were anxious themselves, were very isolated themselves for one reason or another, right? That they were already at their tipping point, but then we were asking them to isolate further, to mask, to take vaccines, to trust science that was brand new in many ways, and listen to them without having a long time to understand, right, to save their lives. And we just put everybody together on the hot seat, didn't we? And we asked providers to be on the line and roll with it and help people, in some cases who may not have trusted their advice anymore. And that was new.
Yep, exactly. So let's talk about the Safe Haven program, right? It's a program that at Medical Society of Virginia, and listeners, you might hear me slip and say MSV because that's what we refer to the Medical Society of Virginia as. And so, Melina, talk to us about what is Safe Haven.
So Safe Haven is a set of changes in the Virginia Code and in law, and now we're working with other states to change their laws in their states, but that specifically provide protections to healthcare providers. We started with physicians, and then physicians and PAs. Then we added nurses and pharmacists and medical students, nursing students, and pharmacy students. And then this year, we're actually adding the dentists because they came and asked. As we're learning more about other professions, and they're struggling as well. We've seen depression and anxiety in dentists, for instance, triple since 2002. So things you learn as you go along. But the legislation provides an opportunity for protection for safe haven services provided through the Medical Society of Virginia that are coaching, counseling, education resources. And the coaching is peer coaching. So they have to work with a certified peer coach and master's level counseling, but we're available 24/7. So that helps with shift work and so forth. But anything that's said during those conversations is considered privileged communications and not for use in a legal court setting, and not reportable to the Board of Medicine. There's an immunity from reportability unless there's a higher probability that that provider is deemed to be a danger to themselves or others. And that definition was very important. Before that, it was very opaque, very unclear what was reportable. And we do want to report bad actors. We want to report people who are in danger to make sure patients are safe. But what we know is they can get care and recover quickly. But it also provides a confidential element from the employer. What we were finding is in healthcare systems, if they were using internal employee assistance programs, some of that information was going right back to HR, which was going to legal and being reviewed for somebody's continued employment, right? Well, those are things we didn't need because it was keeping people from getting help. What we needed is them getting help, and we know help works. And then we're expanding legislation this year that they can actually get medical treatment as part of these protections now as well. So that outpatient medical treatment we know works as well. Once somebody starts to be an inpatient for more than 30 days, then that is reportable to the board.
So how do providers access these services?
So they can buy the service and become a member of SafeHaven. It's $395 for a year, and that includes all the services, not just for you, but also your entire family, which is incredible because a physician peer coach alone, the cost is $500 an hour typically. It's very expensive, and we all know behavioral health is difficult to get and an expensive resource. So it's a very affordable program. But an employer can also provide it to their entire employee set, which really matters because that's the employer saying, we are investing in your wellness. We believe in you, and we believe that you should be getting care, and that is not our business unless there's a point where we need to be intervening and responsible for patient care, right? And we know where that line is. It's a great signal, right, to an employee that your employee cares or employer cares. So you can then, once you are a subscriber, you get given a code and a number, and all it takes is you pick up the phone and you can call somebody 24/7 for an immediate intervention. And then we triage and figure out where you need to go with the help of a highly qualified national service provider called Vital Work Life. We looked at every provider we could in the country, and they have 40 years of experience in this, but they have 20 years experience in healthcare, working with healthcare providers. So it is a special set of needs and perspectives. And you can get help right away. And that means you can get counseling. You can have access to the app and all of the educational materials that are there, some assessment tools, some calming tools, as well as this peer coaching, which has been pretty significant. We've seen. And what's crazy is with these protections, we've seen utilization of programs like this in a workplace go from about 1% among physicians and 3% among nurses to 48% on average when somebody is offered the service. Isn't that crazy? It's unprecedented in the country, this
Wow.
level of utilization.
Wow.
Yeah.
Melina, do you have any stories that you could share that you've been told, some success stories coming out of that
Yeah.
program?
One, we don't have a ton of stories because it's confidential. It's voluntary and it's confidential. But when people, as we're destigmatizing this issue, people are coming forward and telling more stories, and they're serving as an example to their peers. I used it. I used it. So we are seeing people raise their hand. One physician was really open with us recently and shared that during COVID, she had several patients that were older. She tended to see a geriatric patient set in a rural community, and they were really struggling with the vaccine, whether to take it. And she really tried to encourage them and said, you are at the greatest risk of death at this point. And if there are other side effects you're worried about, we can manage any that come up, but death we can't manage, right? We need to get you safe. And she saw a husband wife couple in particular, and they said, well, we don't need it because we never leave our house. And she said, well, you're here now, you're out of your house, and you just told me you went to the grocery store before you came here, and you still are going to your bank, right? So you do leave your house, and that does put you at risk, even if you're not doing a lot. But they really wouldn't move. And she was very worried for them. And within 10 days of that visit, and she had known them a very long time, the husband contracted COVID, and he died within a week of getting the disease. And 2 weeks later, the wife died. And this affected the physician, Trudy, greatly. She said, I was heartbroken from a personal standpoint because I had become close to them, but I wondered, could I save people? Could I help them if they wouldn't listen to me? How do I help them understand, and how do I convince them to be confident in the things that I am confident in, that I've done this vetting for them? And it really did present this sense of moral injury to her. And she wondered, how can I continue practicing if I can't do what I'm here to do, which is save lives and help people? And she called SafeHaven, and we connected her with a peer coach. And that happened to be a psychiatrist in Florida. And because we can get people to outside of their sort of town, they can go outside of the people who know them. They can be more open. And this psychiatrist, within 2 sessions, was able to help reframe the issue in a way that was about respecting their choices and about respecting their right to make choices, but her right to care for them and try to show them, but also leave some responsibility with them, but also know that she could keep going and try again with others, and that there was great love and great care and great service in that mutuality, but that she could keep going. And so she was able to go back into practice, and she said she wondered for a while whether she could continue. And now she knows she can keep doing it and keep serving. And it's been years since then, and Trudy keeps using the program. When she has a tough day, sometimes she'll just call before she goes home and say, I just need to have a conversation before I go visit with my family, because I do not want to take the death of a patient right now home into that environment, because that lands on the family too. And so these services are available whenever they need. And a coach or a counselor, we provide as part of that subscription up to 6 times that you can meet on any issue, but unlimited number of issues. I think it's been really, really important. I have other things people have said, but I think that is one of the most compelling stories I've heard.
When you were explaining and sharing that heartfelt story here about one of these providers, it had me thinking about a show we did, Melina, late last year. We had invited a medical student and interviewed him and why he chose to, get into the medical profession, and what his life is like now, and why not primary care, why special care, just a lot of things we talked about. One of the things he touched on was how during while he's been going through medical school, is that, he's had to be very intentional about his own mental health, you know? And so, can you just talk a little bit about what would be your advice to our medical students who will soon be doctors, right? What would you say to them today as they're going through their training?
Oh, I'm so glad you asked this question. We're so lucky with this young generation. They really embrace mental health and well-being as vital and important, and they are so willing to access it compared to earlier generations that were taught and told this: you can't show weakness, you cannot be there. In fact, I would say this younger generation is even advocating to previous generations. You can do it too. It's okay. Let's change the stigmatization issue in medicine, and I would really encourage them to use that voice. One, it's empowering to change a culture with your voice. And that, I think, helps with our mental health and our well-being anyway. And their voice is so powerful, and their openness is so important. But they are under a great deal of stress. I mean, once you finish college, then you go right into medical school, and the level of training and chemistry and biology and science and the pressure to memorize the anatomy, and I just honestly, I don't understand how they really do it. But then they also have to take these boards that are pass fail while they're taking on at an average of $250,000 debt before they make money as a doctor. It's an incredibly stressful path. So to recognize that those stressors are real, and you're allowed to talk about them, right? You're allowed to name them and talk about them, and that helps as well. But we really want to encourage the students to talk and access Safe Haven resources early in their process. If they talk to a counselor outside of a protected service, that could go into a record that is shared later in their lifetime, or scrutinized by an employer who may not have the same viewpoint that these conversations should be protected. So just be very mindful of what's going to be done with your medical record and your wellness record, if you will, in the conversations. You can talk about it, but watch what you're saying unless you're protected. But seek the protections and advocate for them where you are, because it is how we're going to destigmatize this issue in healthcare.
And, I don't want to get off this topic of Safe Haven, but I am just going to jump off of it for just real quickly for our listeners. Again, going back to that show that we did. And there were some statistics that we had shared with our audience, Melina, around medical students' interests as far as what specialty, right, they're interested in. And the statistics were very alarming in that we are seeing a lower set of these students having an interest in primary care, right?
Yes.
Can you just real briefly for our listeners, because you really understand it. We did hear from the medical student, but what is the data? What is the data telling you, right, as to why they're making these decisions?
Well, there's so many factors. Healthcare is so complicated, I would just say. So there's no simple answer for any of this. But what I would say is they're being advised to go into specialties, and not just specialties, but
Mm,
subspecialties and subspecialties. And it really has to do with affordability. When you are in primary care, particularly if you're in a rural area or among an underserved population where they frankly want to serve more, we see this is their desire to work with people who are underserved, and in stressed environments, because that's why they got into medicine. But the reimbursement rates, particularly for Medicare and Medicaid, are not adequate to repay your loans or run a practice, which is effectively you come out of medical school with this $250,000 in debt, you don't own a car, you don't have a place to live, and you're being asked to take out loans to start a business, right? And this is all before you get married and have children, right? So the weight of this, and you're being asked by the federal and state government to take reimbursement rates sometimes as low as 68% of the market rate for patient care, right? That'd be like asking us to take a 34% coupon on our salary that we do for our job every day, right? Wow, that makes it hard to pay an electric bill, right? Much less afford to have a child or a home. And it's real. I know we think of doctors as having money, but we don't really understand the financial stress that they're under. And we also do not teach doctors about financial management or business management. And yet we ask them to go out into the world and care for bodies and care for patients, which they can do very well, but do that while running a business and having employees you were never trained to manage and deal with. And so it is two sort of sides of your life. And we're seeing that that almost becomes impossible to do. And so many of these, family physicians and pediatricians and so forth are being replaced by employees of healthcare systems, where you become, instead of an independent practitioner, you become an employee, or you're replaced by somebody who hasn't been trained necessarily in medicine or hasn't taken on this level of debt, right? So it's a very difficult uphill climb that we're asking them to do, and a lot of it they just don't feel like they could manage, and they're getting advice that it's very untenable, right? And we're not opening up graduate medical education spots enough in the States. We still have the same number of medical education spots today that we did in the 1970s. So we're not able to train enough primary care doctors, pediatricians either, and keep them in our communities. So we're working really hard to try to get loan repayment plans through and incentives to get people from small communities back through medical education to their communities where they grew up, because we know they're more likely to stay there, and have infrastructure there that could help with some of those issues. We've got a systematic problem, and we have got to address it if we want people to have quality care. So, long answer, complicated answer, but those are a bunch of
and
factors.
I'm glad I asked. And I will tell you, listeners, we're going to continue to bring that story to the table. And Melina, I really hope we can get you back so we can delve
Whenever
into
you
that
want.
a little bit more, because it's important, I think, for not just Virginia to hear about this, but I think all of, right? I've actually been terming this now as not a shortage of primary. I've actually been terming it as a crisis now. I think we are in
Yes,
crisis
yes.
mode when it comes to primary care providers. And so we've got to really figure out an innovative way, I believe, to kind of flip the switch a little bit and get more folks
Yeah.
interested, but working with the system, right, to help them get interested,
Yeah.
right?
That's right. Because it's going to take community leadership. It's going to take state leadership. It's going to take a strategic investment in infrastructure to make sure we've got high quality level care in every community. We really need, and frankly, this is the work they want to do. This is the work they want to volunteer for as well. And many just do that, do volunteer and don't even charge for a lot of their patients in order to help. It's a difficult thing, but we've got to do it together.
We were talking yesterday with our staff, and one of our staff members made a really good point. And she had said that, where are the days when we actually have providers who really just wanted to focus on really just not just the money, right? But just focus on making that person healthy, right?
And they want to. There's not a lack of the people that want to do that work. The system is keeping them from doing that and having a life, right? I mean, a manageable life. And when I say keeping them, $250,000 in debt before you start your first job, 18 years of training before you get your first paycheck. That's crazy, right? We cannot expect these humans, right, to, on a wing and a prayer and a wish, to try something and see if it works out. And then if it doesn't, they're still carrying around the elephant weight of that debt, right? And then they have to pursue another path, right? More education, more debt, more training to pivot. It's a big lift. We should not be putting this on young people. We should be helping them.
And I totally agree. And I think that's where this safe haven, right? I think, and having, like I said, when we had this young man on, he's committed to, completing his training. But at the end of the day, when he was trying to be very intentional on his own mental health, because of some of that.
These stressors are
exactly.
They're real. Yeah. And, when you have a life purpose that's so clear and you want to do it, right? And it feels like you're swimming upstream, that can just wear you out. It just wears a body and a mind out. And we need to protect them with a program like Safe Haven, but we need to fix the system. And we need to do it for patients, right? And for the providers who genuinely want to do this work. And I'll tell you, there are thousands that want to do this work.
Well, Melina, this has been wonderful. I told you, listeners, she is just fantastic. And I can literally sit for hours to just talk with her because she is such a great teacher. And she brings so much to the table for us to think about as a society. Because I know we're doing it here in Virginia amongst the community health centers. And trying to figure out a way to be better employers, right? We're very connected to the Safe Haven program, and we're being very intentional about lifting up our providers through this program. And so,
thank you for that work. Thank you for that work. I know it means the world to them, and you have become an evangelist for this notion that they need this level of care. And it's such an incredible example.
Yeah. Well, thank you. Well, listeners, that's it. Please, continue to listen to CommonHealth because it's folks like Melina that we want to bring to the table so that you're made aware of those community voices coming out of the community health industry here in Virginia and actually throughout the country. So thank you, Melina.
I want to thank my guest for joining me today. And thank you to all the listeners for tuning in to CommonHealth, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support CommonHealth, I encourage you to hit subscribe button and share it with others on social media. Leave a rating and review or visit our website at www.vcha.org. This is Tracy Douglas Wheeler, and thank you again, and I'll see you next time.